Okay, so we are going to talk about neuromodulations in primary headaches tonight, and we'll talk about non-invasive neuromodulation devices first. So there are three main devices for primary headaches. The main devices that we use a lot is Seniha device, which is FDA approved for migraine headaches. So the Seniha device, it has been out for a while and it's available for migraine patients. The new device is Seniha Dual, which means it's for dual therapy, means it's for acute migraine therapy, and it's also for chronic migraine therapy. The company had the one devices which was only for chronic migraines, that the patients were using the device for 20 minutes every day for chronic migraine therapy only. Now this new device is available since September 2017, FDA approved for acute migraine therapy, the Seniha device. And now the device has two settings. One setting is for acute therapy. So when you press the device one time, then the device set up for acute therapy, which is for 1 hour, and you can have indifferent electrical stimulation 1 hour for acute migraine therapy. And if you click twice, then it will be more, I believe, decreased electrical stimulation. Then you will have 20 minutes every day for chronic migraine therapy. So in their studies, it showed that in 2 months you get the maximum benefit for chronic migraine. So if you use the device 20 minutes every day for 2 months, you get the maximum benefits from Seniha device for chronic migraine. Even when we were using the other device, that we were telling our patients that the device is yours, it's chargeable, it's rechargeable, so you can use the device for rescue headaches as well. So when you have acute headache, you use the devices for 20 minutes for your chronic migraine, and then you have another headache, then an acute migraine attack, then you can use the device again for your acute headaches. The other device that we have is GammaCore. Okay. So this device is FDA approved for cluster headaches. We talk about cluster headaches. They are mainly headaches seen on male patients. They are different than migraine headaches. They are short-lasting unilateral headaches, and they are very severe headaches that starts usually seasonal. And when you have cluster headaches, that they comes with these short lasting episodic headaches, that when you have during those episodes, it's only FDA approved for episodic cluster headaches, because during the study it only showed benefit for episodic headache, not for episodic cluster headache, not for chronic cluster headache. So when you have the cluster headache episode, you can use the device during your attack to decrease the duration of your attack and also decrease the severity of your attack. So you find your vagus nerve, and then you put the device, and before that you put the gel on, and then you use the device. And when you use the device, you see that a little change on your lateral side of your mouth, and that shows the effectiveness that you are localized the device on the right area, and it's effective. And if you are seeing benefit, then you can use the device. So now there is patient registry. So the negative side with the device, it's not rechargeable. So you can use the device for a month only, and then after a month the device cannot be used again. So then you have to put the device away, and you have to get another device. So right now we have the patient registry, and during the patient registry they give you 3 devices free. It's also they are waiting for FDA approval for a migraine device. It's look like same, but it's different size, like an apple-sized device. But what we learned is that that device also won't be rechargeable like Cephali. For that device you will need a card to recharge it, and the card will be again very expensive. It will be around $300-400 every month. They are thinking that they will be helping for the patients. They will be giving free cards for a couple months. So we'll see how it works. We have another device called Spring TMS. Spring TMS is FDA approved for migraine with auras. We don't have a demo device. It's a device you put back of your head. It sends a magnetic field, and with that magnetic field it stops the aura, and by that way it stops the migraine. And it only works for episodic migraines, and it only works for migraine with aura. So these are non-invasive neuromodulations, and there are invasive neuromodulations. So neuromodulations means like when your computer is giving errors, or when your computer freezes, then you have to reset your computer. It's the same thing we are doing to your brain. When you keep having chronic migraine, then you have to reset your brain. Then we use the neuromodulation techniques to reset your brain. The invasive neuromodulation techniques, one of them is occipital, invasive occipital nerve stimulation. What they do is first you get occipital nerve block. If occipital nerve block works, but you don't get long enough benefit, then you can get, they put little devices around your occipital nerve. And with that device, if they see that it's working, then they can place invasive occipital nerve stimulation. That's one invasive method. They can also put some stimulation around your supraorbital nerves. The problem with those occipital nerve stimulation, they can get infected, and sometimes the battery dies, and that device can stop working. So those are some downsides of those devices, and we don't have any good research data showing that the devices are working when they compare with placebo. So those are the invasive methods, and they are also talking about invasive vagus nerve stimulation. It was discussed in the past, but then since we have non-invasive vagus nerve stimulation, it's not really a way of thinking anymore. These are some of the things that we use for neuromodulation. Nerve blocks are one of the neuromodulation techniques as well. We do occipital nerve blocks, supraorbital, supratrochlear nerve blocks, auricular nerve blocks, auricular temporal nerve blocks, and with trigger point injections. Those modalities also actually neuromodulation techniques. They can help to reset your brain as well. And the problem with those is the duration. They help 90-95% of the time, that when you walk out from the clinic, that your headaches are almost gone. Usually, even you come with a headache 9/10 severity or 10/10 severity, when you walk out from the clinic, your headache will be 0. But the problem is how long the benefit lasts. I have patients that the benefit can last up to 12 weeks, or sometimes the benefit only lasts up to 2-3 days. For those times that we cannot use those techniques as a preventive, but we can only use those techniques as a rescue. If there is any question, I can take the questions. Okay, so seems like we don't have any question. Thanks for listening and have a good night.